in physiotherapy, and I'm senior physiotherapist at MediClinic. So my today presentation is about ergonomic posture exercise related to musculoskeletal health. So my objective from this presentation today is to understand the work-related injury, to understand office ergonomic and workstation postures, to understand how posture can affect our musculoskeletal health, how exercising is very benefiting in our daily life, and how stress, poor diet, and sedentary lifestyle can lead to injuries, and how we can protect, how we can prevent these injuries. So what are the work-related injuries? Usually it's syndrome of chronic pains. These syndromes might affect the upper limb mainly, especially the wrist, the fingers, especially while typing. As well, it affects the spine, like the neck and the low back pain mainly. And usually the economic burden, after researches, it showed that it go and reach 4% because of work-related injuries. And as well, another study, it proved that $1 spent in ergonomic setups, in exercise program and postural correction, it's as $3 saved in medical appointment, productivity, absenteeism, and sick leaves. So it's really a very high percentage, which we need to take care of and to try to avoid. So neck pain, it's number one work-related injuries. It's which names attack neck, and it's leading cause of disability and absenteeism. And usually it's due to keeping the neck flexed or forwarded because of lack of good posture. So what causes a lot of pressure on our cervical spine and on the surrounding muscles. And as well, there is a study of 500 individuals. 45% of these people, they complain of neck pain, and 65% of this percentage, they are complaining of neck pain related to office work and to sitting position. So it's really high number. And even 10% of this population, they are getting sick leaves because of their pain. So it's really big number. We should be careful. We should try to avoid this musculoskeletal problem, especially the neck pain related to our office job. And we'll pass to the low back pain. It's estimated 4/5 people. That means 80% of the population, they are complaining of low back pain at least one time, one episode in their lifetime. And it's one of the most common medical problems in our society. In manual and desk job, low back is the main cause due to prolonged sitting, to static position, to as well sitting in an awkward position. So that lead a lot of pressure and stress on our spine, on our muscle surrounding, and which lead to musculoskeletal problems. So we can see how low back pain and neck pain are affected due to sitting for long hours. What are the risk factors? Awkward position and static position, and as well repetitive movements, especially when you are using the mouse, the typing. So a lot of pressure, it comes on our wrist, and as well poor workstation ergonomics, poor desk, poor chair, non-ergonomic office. So that leads to office problem. Sedentary lifestyle and inactive life, that's a big problem for our musculoskeletal problem, because when we don't move our body, our joint, our muscles, so it leads to its weakness and it leads to really musculoskeletal problems. Poor diet and smoking, the presence of other disease, diabetes, cardiovascular disease, respiratory disease, which can also affect and increase these problems, and the stress. Sometimes we are saying how stress, it's related to physical pain, but there is a lot of relation between. Later on, I will show you what and how it can stress affect our physical pain. So what is posture? So I'm here today to show you what is posture and why posture is very important in our daily life. Posture is the alignment and positioning of the body while sitting, while standing, while walking, in every position. So now we'll differentiate between good posture and bad posture, and you will tell me which posture you have. If you have bad posture, we need to fix, and if you have good posture, so that's good for you. So a good posture, when we maintain the normal curve of the spine, that means the lumbar lordosis, the thoracic kyphosis, and the cervical lordosis. When it's maintained, so we have a good posture. When we have alignment between the head, the shoulders, and the hips, that means a good alignment and a good posture. When our neck is straight, our head is straight in front of the computer, in front of the screen, that means we are in a good posture. When our shoulders are balanced, our hips are balanced. So all of these factors, it lead to a good posture. So what is Poor posture. Poor posture is when we have slouch position, when we have forwarded neck, when we have bended neck using the phone or the laptop all the time, when we have a flat back, a sway back. Sometimes we don't realize that we are having a bad posture, but whenever we read about it and we see it, we can differentiate and we can know what is better for us. So here we can see while sitting, the middle one is the best posture while we have alignment. The other two, when we have slouch or sway back position, are bad. It's in the same while standing. So please be careful of your posture. It's really important. And here, there is a study as well about while using the phone or the computer when we are bending the neck. So if you can see on the first, when the neck is straight and using the screen in front of us, there is a pressure of 12 pounds. That means around 3 or 4 kg into our neck, which is light. Whenever we go and bend our neck forward, which we do it usually for 30 minutes, 1 hour, so that put a lot of stress. 60 pounds, that means 27 kg. So imagine you are having a bar of weight in your neck for 27 kg for 30 minutes to 1 hour. So that what put a lot of injury, a lot of stress on our muscles, on our spine, and that leads for sure to disabilities and to problems later on. So please be careful. It gives a lot of harm to our neck. Office ergonomics as well. I'm here to show you what is the best office ergonomics, because as well, when we have poor ergonomics, that leads to bad posture and that leads to musculoskeletal problems. So getting the right office ergonomics, it's very, very important. So I will start with the equipment, get the basics right. An adjustable chair is number one. Please invest in your chair, because you are sitting for more than 6-7 hours a day. It's really long time. So an adjustable chair, a comfortable chair, which can preserve your and maintain your alignment and your posture, a good posture, it's really important. Whenever it has arm support, lumbar support, the head is straight, the screen in front of you, over the eye level, especially the higher part of the screen. Later on, I will pass through. And please tell me if you have any doubt about your ergonomy and about your posture. Okay, adjustable desk. Nowadays, in many offices, we have now the standing desk. So that will help the people to avoid any one long static position. So both sitting and standing are not really the best for our body. It's the best is moving. But in our office, we cannot work while moving. So we need or to sit or to stand. So better to combine both standing and sitting. Like that, we change position, we change posture while we are at office. Monitorizer, especially for people who's using the laptops, not the computer. I can see here everyone has computer, which is very good. So whenever you have a laptop, you need to raise it up to use monitorizer to elevate the laptop so it can be in front of your face. As well, footrest, in case your height or the chair it's adjusted, but your feet are not fixed on the floor, please use a footrest. It's not mandatory, just for the one who need it. And as well, ergonomic mouse. Maybe we are using the normal mouse, but the ergonomic mouse, it's very helpful. And because it maintains the neutral position of the arm, so our arm is not twisted, and that will help to relieve from carpal tunnel syndrome, tendinitis, hand problems. So I recommend an ergonomic mouse. So here are the equipment. So we have the adjustable chair, we have the position in the office, we have the ergonomic mouse, and the standing desk, passing from sitting to standing. Okay. So here is very important topic as well, how stress and sedentary lifestyle can lead to musculoskeletal pain. Stress is not a primary cause, as we said, of musculoskeletal pain, neck or low back pain. But whenever research shows that whenever you are under stress, so your pain feels worse because of increasement of the inflammation factor in your body and the cortisol level, and as well activation of sympathetic nervous system, which can affect your body and you can feel your pain worse. That's how stress it can affect. So please try to find a way to get rid from your stress. Whatever it's an activity, sports, a hobby, moving around, socializing. So try to every day find meditation, yoga, to find a way to get rid from your stress that leads to reduce your musculoskeletal problem and lead you for a healthier lifestyle. As well, sedentary lifestyle, it can result in musculoskeletal pain. How? Because when you are not active, not moving, so your muscles are not working, are not strong enough. So a lot of pressure comes into your spine, into your joint. And that's how it leads to joint disorders, spine disorders, and musculoskeletal problem. So it's really, there is a big relation between physical pain and stress and inactivation. And here we'll pass to poor diet and physical pain as well. There is a big relation between a poor diet and physical pain. How? Usually nowadays we are all aware about our diet, what is good, what is bad, a lot of awarenesses and researches around. And it's good that people are more following these tips. But how there is a relation between poor diet and physical pain? So a high diet, rich diet in sugar and processed fat and carbohydrate. So this can increase the inflammation in our body. And when we have increasement of the inflammation or the factor of inflammation, so we have breakdown of the cushion in the disc between the spine. And that's what leads to spine disorder, what leads to degeneration, osteoporosis, osteoarthritis, and leads to a lot of joint and muscle problem. That's why limiting this food, limiting fast food and saturated fat, it's really, really important. And as well, in opposite, a healthy diet rich in protein, rich in calcium, magnesium, fibers, antioxidant. It's really important to maintain our musculoskeletal system very healthy. And as well, being exposed to sun, that will give us the vitamin D, and every day try to be in the sun for 10 minutes. So that will help your bones to absorb the calcium, because without the vitamin D, our calcium is not absorbed, even though you eat a lot or very good, diet rich in calcium. So the calcium plus the vitamin D are really important to improve our bone health and our muscular and musculoskeletal system. And as well, drinking water, it's mandatory. Why? Because the water, it helps the centration of the water inside our disc, and it make it very cushiony. That's why even in our joint and our knees, our hips. So please drink enough water, at least 2 liters in a day. It depends to everyone's weight and gender for sure, but minimum it's 2 liters. Keep 1 bottle of water in front of you and try to drink during whole day. As well, maintaining healthy weight, it's very important, because whenever you have excessive weight, we have a lot of pressure into our spine, our joint, our muscles, and that leads to dysfunction later on. So try to maintain a healthy weight for better health. And now it's my favorite topic, which is exercising. And exercise for office work is not an option, to be honest. Why? Because you're sitting for very long hours. So at least we need to exercise at least 30 to 40 minutes daily. Whatever, any kind of exercise you like, we'll talk about it later on. So, and it's not only for your physical health, it's for your well-being, for your mental health, for your productivity. You are more productive when you're exercising, believe me. When you, also it prevents your chronic workplace injuries. So plenty of benefits and many researches behind that. Maintaining a healthy weight, strengthening our bone and muscle, it reduces the risk of heart and respiratory disease. It improves your balance, your coordination, your mood, as well. It helps you to improve your function, your mobility, your immunity system, and as well, it's source of happiness. Like everyone, they say, really, it affects this much my well-being and my mood. It is, because who doesn't do exercise, he will not know until he does. It's really increase the level of dopamine in our body, and it's a source of happiness. So make it as something mandatory in your life, and like that, you will avoid a lot of problems later on when you're aging. So I'll give you a few examples of exercise which you can combine, which you can do. So I prefer that you combine 4 types of exercise. We have the cardiorespiratory exercise, which help your cardio system and respiratory system. We have the resistance exercise, which help to improve the strength of your muscles and bone. We have the flexibility exercise, which can help to stretch and make your joint more mobile and more flexible. And we have the neuromotor exercise, which most of the people forget about it. but it's really important while aging to prevent falls, to prevent any kind of big injuries. So, and it's about balance and coordination. So combining all this exercise together, it's really helpful. So I'm not telling you to exercise 2 hours every day. I am telling you to exercise 3 times in a week for 1 hour each, or 5 times in a week, 30 minutes every day. Make it as a habit, make it as a joyful activity, but not like, oh, I'm obliged to go to the gym or to do any activity. No, find the activity you like and start with it. It's really helpful. I will give you an example of the exercise. So if you do 3 days of exercise, for example, Monday, Wednesday, and Friday, 1 hour each. So divide like 30 minutes of cardio each, and in 2 days, do some resistance exercise because it's very helpful. And in 1 day, do your stretching and your balance exercise. Or if you have to do 5 days for 30 minutes, you don't have a lot of time during your days. So you can do 30 minutes by 3 days of cardio and 1 day of resistance, 1 day of balance exercise, or 2 days cardio, 2 days resistance, and 1 day balance. Do whatever is convenient for you. Don't oblige yourself. Do what is you feel happy, you feel it's giving you a good time, and you're coming back home healthy and happy. And for the people who are not really sporty people, so they can do some and choose some low intensity exercise like walking, cycling, yoga, Pilates. There is plenty of activity. And for the one who really are into sports and are into professional level, they can go to basketball, football, tennis, long, more than 10 miles cycling, swimming, HIIT training. So there is many options for every one of us. Not like only gym. There is not only gym. There is many other outdoor activities. For sure, when it's sunny now here in Dubai, we cannot go out nowadays, and we are unlucky, but it's fine. We can switch it to indoor activities in these 2 months, but later on, we have the whole year to be outside and to exercise. A lot of people, they are afraid to start exercise because of the injuries, because it's tiring. But I want to tell you, our body is strong. Our spine are strong. Don't be afraid. Start today. Train smart. Don't just follow the trainer, what he tell you, even if you cannot. Follow your body's capacity. Listen to your body. If you feel like, no, I'm not able to go more, please tell your trainer, I'm not able, and stop there, and progressively. So training sport is very important to prevent injury, okay? And as we know, our spine is robust. Try to lift properly, try to sit properly, try to move properly, and like that, you are preventing yourself from injury and from long life problems, okay? A few tips. I will give it to you before finishing this presentation. So please take around 5 to 10 minutes of break 2 to 3 times a day. It improves your well-being, your productivity, your physical activity. So you are moving. Whenever you take break, you get up, you move, you socialize, you go and drink water. So you do something which is really helpful in very small amount of time. Be mindful and practice good posture. Sit properly. If at the beginning, make it as an exercise, and later on it will be a habit. Believe me. Conscious to your posture. Be active and practice your stretching exercise, which I will show you later on. So 5 to 10 minutes of exercise, of stretching a day will keep your joint mobile, will keep your muscles more relaxed, because whenever you are working all the time, so we have a lot of tension on our neck, on our kyphotic posture. So try to be more active, to stretch more during the day. Avoid smoking. I know that a lot of people smoke, but smoking is not really helpful, especially that with the time, smoking can dehydrate our cartilage, our discs, and that lead to degeneration later on and many other diseases. So please try to avoid as much as you can. Eat a healthy diet, maintain a healthy weight, get rid from your stress by doing any kind of hobby and activity you like. Do regular exercise, at least 30 minutes a day. It's really important. And ensure a workstation, ergonomic design, and that's helped you to maintain your posture, to feel more comfortable and more happy. I will pass to the practical session, which is the exercise. If you don't mind, I will be doing the exercise in front of you. We'll be doing it together. So you will stop me if you have any pain, if you feel any discomfort and any stretching. They are very gentle exercise. So keep your body relaxed. You should be comfortable. You should be, as we said, in a good posture while exercising. Never in bad posture because it will be harmful instead of being good. Okay? Legs on the floor. So I will start with the neck and move downward to the other part of the body. Okay? So we'll start. Yeah, please put your, and you can, put this one here and try to go to the side bend. Any pain? You can maintain 5 seconds, relax, and then switch. You will feel the stretch on the side of your neck. This is normal, but not painful, please. Whenever there is pain, you stop, and then you relax. We'll repeat it twice. I can see happy faces here, which is good. Very good. It's fine. So we'll pass to the second one, the same. Just we put the hand over behind the neck and we push downward to the side. Yeah, that's right. No, this way. Yeah, very good. You should feel this part of the neck. Very good. You're feeling the stretch? Any problems? And then to switch to the opposite side. Always keep your neck straight, your body straight. Very good. And then we switch. So we'll do twice each side. Very good. Usually we maintain for longer, for 10 seconds, but because of the time, so we'll do only 5 seconds. Good. The third one is just rotate your neck. It's very easy and simple, but it's very effective. Try to reach to your shoulder, please. Yeah, for some people it's really hard. Very good. Great. And now we'll pass to the shoulders. These are the main 3 exercises for the neck. So shoulder, just try to do. Yeah. I prefer more backwards than front because most of the time we are sitting while hunched. So better not to do too much front. We do more into back. Very good. And then we hold the hand and we push like this. So you'll feel the mid of the back. Okay. And as well, you can go a little closer and we do the opposite. Yes. So you feel all your shoulders are backwards. Good. We'll repeat it another time. Very good. And then to the back. Always breathe. Don't maintain your breath. Don't hold your breath. Always keep your normal breath. Whenever you are able to talk, that means you are breathing properly. Okay? So we'll pass to another one. Put your hand over your shoulder. The other one like this. This is very nice one. Try to pull and to turn. Yes. Don't move your arm. The front arm should be straight. And then the opposite. Yes. Yeah, it's a good mobility for the mid-back, which is really helpful while sitting. Okay, another time. One more to the other side. Very good. It's fine? Any pain? All good? So now we'll pass to the lower part. And while sitting, it's all the exercise while sitting. So it's very helpful. Try just to bend forward. Straight. 5 seconds. Then to one side to stretch all the low back muscles. And then the other side. Yes. Very good. And then to one side. Try to touch your feet or the floor if you can. Very good. And the last exercise for today while sitting, because here we don't have capacity to stand and do the exercise, so we'll do all sitting. The last one, just you cross. Yeah, I know it's hard little with the jeans, but try. And try to go forward So you will feel the stretch over your glutes. That's very helpful, especially when you sit for long. And the same. We can do it while standing as well. Yes, like that. Very good. It's very nice exercise to improve the mobility of your hips and to stretch your glutes. Take 5 minutes only. You can do it 2-3 times a day and you will feel yourself better. You will feel like you are more mobile, more stretchy, more flexible. So please try to do it. Now, if you want, we can pass to the offices. I can check your posture if you want. If you have any doubt about your posture, about your setup, please let me know so I can fix it. Okay? Thank you.